The holiday season is not always full of joy, and many experience the holiday blues with anxiety and depression. We discuss how to mind your mental health during the holiday season and beyond. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University. Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger, Atlantic City Electric, energy for a changing world, and South Jersey Gas. Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. The holiday season is not always a cheerful time, and many actually experience the blues during the holiday season. Joining me to discuss minding your mental health during the holiday season is Dr. Brian Isaacson, who is an associate chairman of the Department of Psychiatry at AtlantiCare. Doctor, welcome to Latino Motion.
Thank you, Bert. I'm glad to be here.
Now, this is a cheerful time for many folks, but then you have folks who go through depression and certainly have a hard time during the holiday season. Tell me what causes this.
There's a multitude of factors that can contribute to this holiday blues, as you called them. One of the issues is that there's a lot of psychological pressures around the holidays. People feel pressure to buy gifts, maybe spend more money than they have. People may find pressure as far as not seeing loved ones and may feel depressed about that, particularly if they've lost a loved one who's passed away or they're just estranged. So there's those psychological factors, and then there's also biological factors such as the decreased sunlight, which actually causes chemical changes in our brain.
So that really has an impact on your mental health?
Absolutely. Serotonin is an important chemical for our brains and depression, and not having enough sunlight can contribute to seasonal depression and the seasonal blues.
And of course, you mentioned the stressful time, perhaps having unrealistic expectations or not getting your expectations met. Doing the shopping and everything else. But there's also sleeping and eating appropriately. Does that contribute as well?
Absolutely. When you have a lot of carbohydrate craving and a lot of excessive carbohydrate consumption during the holidays, it can cause glycemic index changes where you have wild swings of your sugar levels. That can contribute to depression. Some of the chemicals that you eat during the holiday season can actually lead to decreased serotonin production, and that can also contribute to depression during the holidays.
Of course, we always overeat during the holidays as well, and you get to that point where you're trying to meet expectations. Tell me, what's the best thing you can do to kind of take it easy during the holiday?
Well, I think one of the things that people feel sometimes, especially people who are isolated, they feel estranged and they feel disconnected. Okay. So I think it's important to be connected to your friends and family. If you don't have friends and family, be connected to the community around you, be active, exercise appropriately, try to eat in moderation, try to enjoy the holidays, but do so in a safe and healthy way.
So when do you distinguish between just a simple holiday blues and a major onset of depression?
So a major onset of depression is when you have a constellation of symptoms. It's usually 5 of 9 symptoms, including disrupted sleep, decreased interest, feelings of guilt, decreased energy, inability to concentrate, really sad mood, crying spells, and in some severe cases, even suicidal ideations. So the seasonal blues don't have that severity of symptoms or that number of symptoms.
widespread would you say is the seasonal blues?
So studies vary, but it's anywhere between 5 and 10 million Americans that they say have seasonal blues to some extent.
So that's significant. That means that maybe you're suffering, or you know of a family member who is.
If you look at the statistics, you're likely to either know someone or know at least someone who knows somebody who is suffering.
Right. So this is actually very important information. We want to continue this line of discussion. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We'll continue to discuss how to best deal with the holiday blues with Dr. Brian Isaacson. He is the Associate Chairman of the Department of Psychiatry at AtlantiCare. And Doctor, we were talking about some of the causes of the holiday blues, a lot of stress during the holiday season. But what are some of the signs to know that you're in trouble, that you should get help?
Certainly if you're starting to have impairment in your ability to function from day to day, if you're unable to do your job or take care of loved ones or interact with people. Certainly if you're starting to have suicidal thoughts, that's a sign that it's progressing to major depressive disorder and is a serious health concern that needs to be addressed immediately.
Sometimes I would think that family members probably know something's off. What should a family member do when they see that?
Well, one, you're right. Family members often realize there's often a change in personality, change in habits. And if a family member notices that someone is getting into trouble, they need to have an open, frank discussion with them. Tell them their concerns. Tell them that they're worried about them and that it's time to get help from a professional. You know, one of the things we need to do is reduce stigma. It's such a big barrier for people getting treatment. I always tell people mental health is a disease just like any other disease. Yeah. Diabetes, I'm sorry.
No, that's an important line, an important topic, because people do have that stigma and they put off getting treatment.
Absolutely. And I don't want stigma to stop anyone from getting treatment, because diabetes, mental health, these are both biological illnesses. We would never stop getting treatment for our diabetes because we're afraid of how people are going to judge us. It's not a moral failing to have a mental health issue. It's due to chemical changes in the brain. And just like diabetes, it's something that can be controlled with professional treatment and have a nice, healthy, productive life.
And you mentioned the professional treatment, which is important. And even though you're a doctor and we're on TV, this is not free medical advice, right?
Absolutely.
We do want to let folks know if they're having a medical emergency, they should call 911, and also the fact that there is a crisis line. Tell me about the crisis line.
So the state has a 24/7 crisis line that's 609-344-1118. And that can be reached at staffed by professionals at all times. And that's something you can call if you're not sure if you need crisis or not, but you think you might. It's time to call. Don't hesitate. You gotta speak up. You can save someone's life, and it's really important to reach out and get that help.
What advice do you give family members who may be dealing with a family member who's refusing to get help?
That's a difficult thing that I hear from a lot of family members. And I think one of the key things is to try to find something that helps motivate them and try to use that as leverage if you need to. I think it's also important to tell them how much you love them and how this is coming from a place of love. And you just want to be there for them and you want to be supportive of them. You're not doing this to punish them or to hurt them, but you're really trying to get them the help they need.
The other side of this is there may be folks who are looking to get help and maybe don't have the insurance.
That is a problem. One of the things that I'm very proud of is AtlantiCare has clinics where we take people with every insurance or no insurance. And there's other providers in the community. We're here to help people. And that, I know, is always a concern, but there are options out there.
So that crisis number could direct you to free services?
Absolutely.
All right, we want to continue to discuss some other things and really the integration of behavioral health with primary care. We're going to take a quick break. We'll be right back with more Latino Motion. Welcome back to Latino Motion. We're once again with Dr. Brian Isaacson. He is the Associate Chairman of the Department of Psychiatry at AtlantiCare. And Doctor, we were talking about where to get help, and there is a crisis line, and obviously if you really are suffering and know that a family member is suffering a medical emergency, it's important to call 911. Let's talk about the impact of not getting help on a timely basis for behavioral health.
There are so many impacts, Bert. For one, depression untreated can become worse and become, the most obvious impact is if it continues to become more severe and out of control, it can lead to suicide. That is a major, major health epidemic. We're seeing an increasing number of suicides nationally. But there's also the less obvious, more subtle findings. Untreated depression has actually been linked to increased cardiovascular disease risk. It's been linked to more medical morbidity and mortality. It's been linked to being overweight. It sort of becomes a vicious cycle of overeating, depression, poor self-esteem, and it becomes this vicious cycle. And so that can lead to multiple medical poor outcomes.
We also know that some people try to self-medicate, so they may turn to alcohol, drugs, or other means to deal with the depression.
Absolutely. One of the big issues, there's a high degree of comorbidity between untreated depression and alcohol use disorder, as well as opioid use disorder, and other substance use disorders as well to a lesser extent.
Let's talk a little bit about the treatment. What is the treatment for depression?
So for generalized depression, significant clinical depression, the most preferred treatment is usually a combination of cognitive behavioral therapy, talking to someone, helping solve problems, sort of helping reframe your thoughts, and a medication, usually an SSRI, which stands for selective serotonin reuptake inhibitor. But antidepressants plus therapy are the treatment of choice, usually, for severe clinical depression.
And again, if someone needs help and the crisis line, let's give that number out again.
Sure, the crisis line for the state is 609-344-1118, and that's 24/7.
So we're doing the holiday shopping. What other things should we keep in mind to make sure that we're minding our mental health?
So for more mild cases, the key things are to be connected to people, to exercise, to eat properly. Make sure you get enough sleep too. Sleep sort of becomes the back burner sometimes as we're running around trying to take care of all the things we have to do as the holiday season approaches. It's really important to get a sufficient sleep.
What advice would you give to those individuals who may be taking care of seniors during this time of year?
Don't neglect them. You know, one of the things is seniors have seen more loss than most people.
Oh.
They've lost their friends, they've lost loved ones. It's very easy for them to feel discarded. Maybe their own children have their own families and sort of become more involved with their own families. It's really important to reach out to our seniors, make sure they feel connected, make sure that they're really part of the festivities, and make sure that they're having good mental health and that we're there for them.
Very, very important, certainly, to include all the family and make sure no one gets left out.
Absolutely.
This is a critical time of the year that obviously we want to make sure that someone else, you're not contributing to someone else who's getting the blues, right?
Absolutely.
We're going to continue and talk a little more about some of the other things that AtlantiCare offers by way of mental health. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. I'm here once again with the Associate Chairman of the Department of Psychiatry at AtlantiCare, Dr. Brian Atkinson. And Doctor, we were talking about all the great things that AtlantiCare is doing, certainly giving advice about minding your mental health during the holiday season. Let's talk about the integration of behavioral health with primary care.
Sure, absolutely. It's one of many of the AtlantiCare initiatives I'm very proud of. It's really at the vanguard. What we are doing is we are embedding social workers and other therapists within primary care offices. We know that people prefer to receive as much care as they can in one place rather than have to go from office to get their various needs met. So we've taken the initiative of implementing the integration project where we're really integrating mental health right in primary care offices.
It's very important, certainly, to alleviate some of the stigma associated with mental health, but it's also aligning the fact that mental health does contribute to your physical health.
Absolutely. I like to think of it, there shouldn't be any divide. It's all health. It's a person's health. We're a whole being. Our mind and body is connected. It's all interconnected. And there really should be no divide even.
So I know I went to my primary care, and the social worker came in, asked if everything was okay. I know that when you go to your primary health provider, they do ask you a variety of questions to see if you're in need for additional counseling.
Right. There was actually a study that showed over 50% of people who commit suicide have talked to their primary care doctor within a month. So AtlantiCare committed the resources to say we are going to screen every single person who comes through our doors for depression, and if they show any positive signs of depression, we're also going to do a further assessment for suicidality. And so AtlantiCare does that for every person, and I think that's really a key step to trying to help reduce the rate of suicide in our community.
Let's talk about one segment of the population that perhaps doesn't get addressed as much because they're young and healthy, the teens.
Yes.
And they often are a target for bullying and other things that they suffer and may need that additional help.
Well, AtlantiCare does, we see that there are many teenagers in our community who are being bullied and who are dealing with mental health issues. So one of the things AtlantiCare has done is several schools actually have teen health centers embedded in them to deliver mental health and psyche and support right there in the high school. And this is something that's been really great. We've identified youth at risk, and then we get them further treatment if they need it as well.
So if you're a parent and dealing with a teen who you know is having mental health issues, what should you do?
If you're a parent with a teen that's having mental health issues, you definitely need to talk to them. Be open. I know teenagers can be tough to talk to sometimes. My daughter's 10 going on 25 right now, and she doesn't always want to open up, but you have to keep pushing and trying to be open for them, be available for them. And if you start seeing these warning signs that we've talked about, you have to be ready to take them to a mental health professional and get the help that you need.
Is that number that we gave still a good number if you're getting help for your family member or your teen?
Absolutely. That's 609-344-1118. That's a state crisis line that serves people of any age.
And they could also provide you with resources if you need to get a hold of someone else.
Absolutely.
All right.
And the other number, if you ever don't feel like it's a crisis, but you want to look for help, if you don't mind me giving, it's AtlantiCare's access number. It's at 1-888-569-1000.
All right. We're going to continue. We're going to be right back with more Latino Motion. Welcome back to Latino Motion. And once again, have the pleasure of having Dr. Brian Isaacson, who is the Associate Chairman of the Department of Psychiatry for AtlantiCare. And Doctor, you certainly have given us great advice about the holiday blues, but I want to talk about you and certainly this field of psychiatry, which is very, very important. Tell me a little bit about how you guys started in this field.
Sure, absolutely. So I came back from, first I went to university. I'm local. I grew up in Egg Harbor Township.
Okay.
Went out to USC and then came back from medical school here locally at UMDNJ. And in my third year of medical school, I wasn't sure exactly what specialty I wanted to be in. I was motivated by Dr. Kwan, who was my pediatrician locally, and I knew I wanted to talk a lot to my patients. Dr. Kwan talked a lot to me as a kid. And so I did each of the rotations. I did surgery and knew that wasn't the best fit for my skill set. And then I got to psychiatry, and I knew it was perfect for me. I had always been a great listener. I always had plenty of time to talk to people. And I really was passionate about helping people with mental health issues, like some of the issues we've talked about today. And I knew that I wanted to be a child psychiatrist almost instantly after that rotation, which I'm an adult as well as child psychiatrist.
And that happens to be a very on-demand field. I understand we have a shortage of psychiatrists, and especially child psychiatry.
Absolutely. There's a huge local and national shortage of both general psychiatrists and child psychiatrists. Child psychiatrists, there's only about 8,000 nationally who are board certified, and there's estimated it's needed about 30,000.
Wow, that's significant. And obviously there's more awareness of mental health and more people who are looking for help.
Absolutely.
Let's talk about what the process is, because psychiatrist is, you go through the same process to become a regular medical doctor. In fact, you had those rotations as well.
Right. So just like I mentioned, you have to go to 4 years of undergraduate. Usually, there's a few programs that have accelerated. And then you have to do 4 years of medical school, at either an MD or DO school, an allopathic or osteopathic school. And then you have to do a 4-year psychiatry residency as well. So it's 12 years of education, and then after that you can prescribe, unlike other mental health workers.
So the difference between a psychiatrist and a psychologist is that you prescribe, they can't.
Right. Psychologists don't go to medical school. They go to undergraduate and sometimes graduate level programs. They're able to do therapy, but in New Jersey they're not able to prescribe medications, whereas a psychiatrist, being a medical doctor, can prescribe medication.
And you did mention the fact that there's career opportunities here locally. You're a local person, came back locally, and we need more doctors here.
Absolutely. AtlantiCare is always looking to hire great psychiatrists, and if we can have them grown locally, even better.
Let's give all the information again. Anyone that is having or is aware of a mental health situation happening in their family, what's that access number again?
The access number for non-emergency care is 1-888-569-1000.
And then there's the crisis line?
Right. If someone thinks they might be in crisis or a loved one might be in crisis, then they can call 609-344-1118.
Give me one short answer. What's the best thing to do for that holiday blues?
Be active, be connected, be there for each other.
Let's end with that. Thank you so much for sharing
You're
this
welcome.
information, and thank you for joining us once again here on Latino Motion.
Choose to get your feet wet. To learn more about protecting our environment.
Choose to read minds, to understand the human brain.
Choose to get your hands dirty, to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger. Atlantic City Electric, energy for a changing world. And South Jersey Gas.